Hello, my name is Beck Williams, and I'll be demonstrating my range of motion checkoff. Um, First thing I'll do is introduce myself. Hello, my name is Beck. I'm going to be your nurse today. Can you tell me your name and your date of birth? And then I'll check their medical wristband and make sure everything aligned. And I'll perform good hand hygiene or proper hand hygiene and discuss with the patient what we're going to be doing, range of motion exercises. And then I'd ask them how they're feeling, and depending on what they said, I would then I would later assess them and see how they physically and visibly look and feel prior to doing the exercises, and whether they felt good or good enough to do them or not is whether or not we would do them, just to prevent injury. So with the range of motion checkoff, we're going to start in the neck area. We're in extension right now, and we're going to go to flexion, back to extension, hyperextension, back to extension, lateral flexion, back to extension, rotation, back to extension. Then we're going to go to the shoulder area, extension, flexion, extension, hyperextension, extension, abduction, adduction, external rotation, internal rotation. And then we're going to go to the elbow. We're going to go flexion, back to extension, supination, pronation. And we're going to go to the wrist, extension, flexion, extension, hyperextension. Then we're going to go abduction, adduction, extension, and then we're going to go to the thumb area, extension, flexion, extension, hyperextension, and then we're going to go opposition, touching each finger, and then we're going to go to the fingers, and we're going to go extension, flexion, extension, abduction, adduction, and then we're going to go to the hip area, extension, flexion, hyperextension, extension, abduction, adduction. And then we're going to go to the inner thigh area, and we're going to go internal rotation, external rotation. And we're going to go to the knee, and we're going to go flexion, back to extension. And then we're going to go to dorsal flexion, pointing the toes upward, plantar flexion, pointing the toes downward, and then we're going to go to the ankle area, inversion and eversion, and then we're going to go to the toe area, the toes. This is known as extension. This is extension, and pointing the toes downward is known as flexion. And after I finish with the patient the range of motion exercises, I would then help them get back into bed into a comfortable position, asking them if they needed anything or how they felt, or if they were in any pain, and then I would let them know that or provide a nurse call button nearby within arm's reach, and let them know that they could call me anytime they needed to, and then I would perform proper hand hygiene.
Yeah.